Do you find yourself waking up in the morning with headaches? It's probably because of the position you're sleeping in, especially if you're someone who doesn't suffer with headaches regularly and your headaches tend to go away within 10 to 15 minutes of getting out of bed. Chances are good that it's your sleeping position that's bothering you, leading to increased stress in your neck and shoulders and causing your headaches. Today, we're going to talk about what you can do to improve your sleeping position so you wake up headache-free. Many people do not suffer with headaches on a regular basis, but find that due to their sleeping position, they will wake up and have pain or headache for about 10 to 15 minutes. Now, they don't even necessarily need to take medication to relieve that pain and headache, but wouldn't it be nice to wake up and not have that first thing in the morning so you could just start your day feeling good and refreshed from a great night's sleep? There's some really simple things that you can do to make sure that you wake up without headache pain. So first, let's discuss what it is that actually causes that headache pain upon waking up. Most commonly, it's because of the position that your head is in. Either there's too much compression in that things are being squished down, or there's too much tension in that things are being too lengthened for a long period of time. This is particularly concerning if you sleep on your stomach. So all my stomach sleepers, you have to turn your head in order to be able to breathe, which obviously puts a lot of compression on one side and a lot of lengthening on the other. So first thing I'm going to ask is, if you're a stomach sleeper and you find yourself waking up with headaches, I need you to find another position to sleep in. I prefer side lying, but even on your back is going to be a better position for you to eliminate your headaches in the long term. Now, you may be saying to yourself, well, Dr. Amy, I'm already a side sleeper, and yet I still wake up with headaches. Well, my friend, then my guess is that you tend to be a tension sleeper, in that everything comes up right by your face. Your shoulders come up, and often people will tell me that their hands are up by their face. You may say, I don't have my hands by my face, but you may have your hand underneath your pillow. You may have your hand underneath your head. You may have your hand close to your body, which elevates your shoulder. That causes a lot of tension in your shoulders, which can lead to headaches upon waking up, which is also why they go away in about 10 to 15 minutes and don't seem like a huge deal. Because as those muscles get some blood flow, you get moving in the morning, things start to feel better and those headaches go away, which is great, but wouldn't it be better to wake up without the headache in the first place? Now, I understand that there are some back sleepers who still wake up with headaches, and chances are good that that is because of your pillow. Many of my back sleepers either have a pillow that's too high, that again causes that tension, or they don't have enough support and they sleep with a chin jut, which causes that compression. Again, it's usually a compression or a tension issue that causes those headaches in the morning. So what can you do about it? You need to modify your sleeping position and make sure you have a pillow that properly supports you. All right, so let's talk about your pillow. I recommend using the Pillowise pillow, and the reason why I like this pillow is because you can see that it has a little bit of a bump right here. This is where your neck sits. This flatter part up here is where your head sits. Now you can see that this one is blue. That's my size. But the Pillowise pillows come in 6 different sizes. So you actually get measured based on your neck and your head so that you find the right position for you. But the goal of this is to make sure that this hollow in your neck is supported, that your head is supported, and that your shoulder is stopped from going up by your head. So here's what it looks like when I lay down. See, even if I want to try to bring my shoulder up, I'm kind of stuck here by this pillow, which is good for me. I am a shoulder tension sleeper, okay? If you're a shoulder tension sleeper, the other thing I'd recommend is putting a pillow in front of you so you can kind of hug it. That helps to keep that shoulder down as well. And that way, this shoulder doesn't end up by your ear. But this pillow here, this is holding me in a neutral position so that my spine and my head are all neutral right here. So I'm not stuck in this position, I'm not stuck in this position, or anything like that. Now, if you're a back sleeper, you may be saying, well, Dr. Amy, that's great for side sleepers, but But does that still work for back sleepers? And yes, my friends, it actually does, because you actually have an arch in your neck this way too. So that's what I love about this pillow, is if I'm sleeping on my side or I'm sleeping on my back, my head and spine are in a neutral position, and I don't feel like I'm forced too far up or too far down. Now, I am someone who will either put too much pillow up and again cause that tension, or if I just have a regular flat pillow, I'll find myself waking up with my chin jutted up. So how do I know this happens? Because it happens to me, or I should say it did happen to me before I got this pillow. Now, you may say, I can't get this pillow. That's all right. You can reproduce these results at home. You can take a flat pillow, just a regular pillow, roll up a small towel and put it underneath to make sure that you have that curve in your neck supported. Again, you want to make sure that it stays in place, so you're going to have to put it in that pillowcase really tight if you're a side sleeper and a back sleeper. But if you tend to stay in one position during the night, that can be a really easy trick to try. And for my patients who are wondering if this pillow will work for them, sometimes that's what I have them try in the first place anyway, so that they can feel more comfortable with that before purchasing a pillow. No matter what you do or what position you sleep in, you want to make sure that your neck is properly supported, because that keeps your spine in alignment. Your head is properly supported so you don't have too much tension through your neck, that your shoulders are staying down. You may need an extra pillow for that. And bonus tip for my ladies, it's good to have your hips properly supported. So I usually recommend a pillow in between my knees as well. That way your entire spine is in alignment. But to be fair, the pillow in between your knees will help your low back as opposed to your headaches. Now, we'll drop a link below to the Pillowise pillows so you can find someone near you to get you measured for a pillow. If you happen to be in the Maple Valley, Washington area, we would definitely love to see you in the clinic for a complimentary fitting to make sure you're getting the right size pillow for your neck. However, the important point is finding a pillow that works for your body, that keeps your spine in alignment, that supports your head, that decreases neck and shoulder tension to decrease your headaches in the morning. So, what can you do about it? You need to change your sleeping position.